Okay, go ahead.
So our group was researching the U.S. Department of Health and Human Services. So what is the Department of Human Services? It was founded on April 11th, 1953, and it's based in Washington, D.C. It's commonly known as HHS, or simply the Health Department. It's a cabinet-level department within the U.S. federal government, and the goal of the department is to protect the health of all Americans and to provide essential services. Their mission statement: it is the mission of the U.S. Department of Health and Human Services to enhance and protect the health and well-being of all Americans. We fulfill that mission by providing for effective health and human services and fostering advances in medicine, public health, and social services. The Department of Health and Human Services provides more than 100 different programs. They're all in place to protect the health of all Americans and provide essential services, especially to those who are least able to help themselves. So there's about 100 programs, but I just highlighted some of them. This includes Medicare, disease prevention and immunizations, low-income financial assistance, Head Start program, food and drug safety, child support enforcement, emergency preparedness, health info technology, preventing child abuse and domestic violence in the home, substance abuse treatment, and assets for independent living.
Sorry, that's me. All right. HHS, or U.S. Department of Health and Human Services organizational structure. The HHS organizational structure, head of command, oversees and administers to agencies and divisions on a national level. It includes a secretary, deputy secretary, chief of operations. Next. The HHS agency and divisions is comprised to provide assistance or guidance and to ensure organizations are operating in accordance to laws and regulations. These agencies and divisions include Administration for Children and Families, Administration for Community Living, Agency for Healthcare Research and Quality, Agency for Toxic Substance and Disease Registry, Assistant Secretary for Financial Resources, Assistant Secretary for Global Affairs, Assistant Secretary for Health, Assistant Secretary for Legislation, Assistant Secretary for Planning and Evaluation, Assistant Secretary for Preparedness and Response, Assistant Secretary for Public Affairs, Center for Disease Control and Prevention, or CDC, Center for Medicare and Medicaid Services, or CMS, Departmental Appeals Board, Food and Drug Administration, or FDA, Health Resource and Service Administration, Immediate Office of the Secretary, Indian Health Services, Office of Civil Rights, Office of Inspector General, OIG, Office of Intergovernmental and External Affairs, IEA, Office of Medicare Hearings and Appeals, Office of General Counseling, Office of National Coordinator for Health Information Technology, Substance Abuse and Mental Health Services Administration. A few on a national level: Administration for Children and Family is a division for Department of Health and Human Services who promote of economic and social well-being of children, families, individuals, and communities, with leadership and resources for compassionate, effective delivery of human resources. For Agency of Health Care Research and Quality, it is invest in research and evidence to make healthcare safer and improve quality. It creates materials to teach and train healthcare systems and professionals to help them improve care for their patients. And it generates measures data used to track and improve performances and evaluate progress of the U.S. health system. Those are just a few examples of these agencies that assisted on a national level. Next. There are 10 HHS regional offices which are available to serve at the state and local organization level. For example, in Region 9, where I live, it serves state and local organizations in Arizona, California, Hawaii, Nevada, the South Pacific areas of American Samoa, Commonwealth of the Northern Mariana Islands, Federated States of Micronesia, Guam, Marshall Islands, and the Republic of Palau. Next. Next.
Okay, this one's me. We kind of did the same topic, but I think we can touch on different things. But some of the organizations and divisions that were just talked about, there are 11 operating divisions together, and then 8 public health ones. And those are like the healthcare and research and quality, the CDC, the FDA, and the NIH, and the Substance Abuse and Resource Administration. I mean, you can't really see it on that chart, but, and then there are the 3 remaining ones are just the human service agencies. Next. So the secretary and the deputy secretary and chief of staff, pretty much they've got one mission, and that's to just kind of make sure everything runs the way it should. They've got so many divisions, so many operations going on within that they're just kind of the top to make sure everything's running all right within the government. Next. Okay, so I wanted to look more into some of these main ones that were at the top of the chart, just because they seemed more important. But the Office of Health Reform, it gives leadership in the policy making and the priorities and objectives to implement the Affordable Care Act to obviously get the quality of care higher, do whatever they can for like money-wise, quality-wise, just to get the quality of our healthcare higher and higher within the Health and Human Resources. Next. The other office that was the main office was the Office of Intergovernmental and External Affairs. And they, like kind of as the name implies, they go within a state level and then a local level or a tribal level to work within the governments or government organizations if they don't have a government. They work with the stakeholders and they communicate with these tribal and or local state government agencies to communicate the policies of the Health and Human Resources. And they don't just represent these places in like policy making decisions, but they also, like I said before, communicate and clarify what the government is trying to get to them and clarifying what they do. Next.
Okay, so I covered the functions of the department, and so they have quite a few different functions. The first being they provide healthcare coverage to more than 100 million people. They promote patient safety and healthcare quality. They eliminate disparities in health as well as healthcare access and quality, and protect vulnerable individuals and communities. Sorry, go ahead. Next. They also conduct health, public health, and social science research while creating hundreds of thousands of high-quality jobs. They leverage health information technology to improve the quality of care, improve maternal and infant health, promote the safety, well-being, and healthy development of children and youth, and support young people's successful transition to adulthood. They promote economic and social well-being. Next.
Okay, I had the personalities, the principal players of HHS. So as you can see here, we have Sylvia Burwell. She's the secretary. Mary Wakefield as acting deputy secretary. We have the inspector general, the director for the Office of Civil Rights, and Vice Admiral Vivek H. Murthy, and he's the Surgeon General. Next. Then we have Nancy Griswold, who is Chief Administrative Law Judge for the Office of Medicare Hearings and Appeals. We have Emily Barson, Director of Intergovernmental and External Affairs. We have Susanna Fox, who's the Chief Technology Officer. We have Andrew Bindman, MD, who is the Acting Director for the Agency for Healthcare Research and Quality. And then we have Thomas Frieden, who is the Director for Disease Control and Prevention, and he's also the Administrator with the Agency for Toxic Substances and Disease Research. Next. We also have Andy Slavitt as the Acting Administrator for the Center of Medicare and Medicaid. Francis S. Collins, Director for the National Institutes of Health. Dr. Robert Califf for the Food and the Commissioner for the FDA. And we have Kara Enamato, who is Principal Deputy Administrator for Substance Abuse and Mental Health Administration. And we have Jim McCrae, who is Acting Administrator for Health Resources and Services Administration. And the next one I can't see because it's covering the slide. Okay, next.
All right, great work. One thing I want to point out for you guys, but also the rest of the class to make sure that you remember. Actually, Shannon, can you go back a couple slides? Nope, sorry, go forward a little bit. One more. Mr. Andy Slavitt there, know that name. That might come up on a test. And what does he do, okay? Obviously, he's the acting administrator for CMS, so when knowing about CMS, know about Andy Slavitt and the things he does. But fantastic job, y'all did really well covering the content. HHS is a huge organization, obviously. As we read from the different organizations that are within there, I mean, it's ridiculous how many different things there are. Within the HHS. So big topic, big thing to cover, but you did well. So I do this with every group. I just ask each of you what was the most interesting thing that you learned while you're studying. So I'll just start with Alexis, and then we'll go to Emily, and then Emily Christensen, and then to Emily Malacher, and then Melanie, and then Shannon. So Alexis, what was the most interesting thing you learned while studying?
Okay, so I actually wrote down a few interesting facts that we could have covered in there, but so the HHS budget accounts for 1 out of 4 federal dollars, and they also administer more grant dollars than all the federal agencies combined. And finally, I found when I was researching that Medicare and Medicaid is 25% of all Americans' health insurance. So I think that what I learned and found really interesting from HHS is that their reach and aid they provide is really impressive. And like we already talked about, they're a huge organization and they're able to provide really good services for a lot of people.
Awesome. Thank you so much for that. Really good job of adding some things to Emily Christensen.
I would probably say, I mean, you kind of talked about it before, and I even emailed you about it earlier, but I was just confused when I was doing my research because I was seeing such huge names like the CDC and the CMS and FDA and stuff like that, and I was thinking, those are huge organizations. Surely they're not all within one. And so that's why I had that question, because all of these huge organizations are in this one these services, and that's not even it. There's 11 more of them, and like so many departments under the Office of the Secretary. And so I think I just didn't realize how how huge and important, not that if it didn't have those big ones in it wouldn't be important, but how big and how much of our healthcare system is within this one organization, if that makes sense.
Yeah, definitely. I mean, when I first learned about this, I thought the same thing. It's huge. There's so many things that will fall within that. You hear about the CDC, you hear about CMS, you hear about the Office of the Inspector General. You think they're all independent on their own, but they're really not. They all line up under the Department of Health and Human Services, and they all report to Sylvia Matthews Burwell. So, yeah, great job. All right, Emily Galliper.
Yes, I'm here.
Yeah, same question. What was the most interesting thing that you learned as you were studying this topic?
Well, being that that I am striving to achieve a bachelor in public health, and I do work in the healthcare system as of right now. I do work in a hospital, or a small community hospital. There was a few organizations. It's not only pertaining to our health. Of course, we know CDC. Here in Hawaii, we had Zika, we had dengue, we just had Hep A outbreak. I mean, those fall under that category. I work at a cancer center, so we have the FDA. Every day, FDA is approving a new cancer drug. So like recently, we found out Keytruda, which is an IV chemotherapy drug that helps. We just found out it was approved for head and neck. So these organizations, within these organizations, they branch out, and I understand they branch out in several levels, and they come out with new safety, or they're always regulating or watching for our public safety. Now, in different countries, the doctor I work with maybe worked in New Zealand and in different countries, but when he came back to America, he said, "Oh, I forgot, we got to watch the FDA." So the FDA is there for our safety. The other thing that I learned too is not only it's about our safety, it also helps prepare doctors. It helps prepare nurses. They have the AHRQ, or Agency for Healthcare Research and Quality. So other than just the Health and Human Services, it also branches down to making sure that we are receiving the best quality of care from our providers, from our nurses, from our healthcare administrators, and so forth. The other thing I like too is that they also service for our elderly, our poverty, our children, and also I noticed they have it on the Indian level. So being that I'm Hawaiian, I hope that they'll achieve it on a Hawaiian level. But I thought that was really cool that each on a national level, this is on the national level. So it gets a little, it's very broad, but if you look at it on a national level, that it branches out into so many different agencies, and those are overhead or overseen by the secretary, chief of office, and so forth. I mean, it's very involved. It's huge. The only thing I didn't see in there that I found was interesting, it did include regulations for insurance companies, or maybe I missed that. But I thought with the new Obamacare, they would maybe include that part of the Health and Human Services, because I know insurance companies make it very difficult for our patients, or patients to get health care in our country. They make it very difficult. But anyway, that's the only thing I noticed. Other than that, I learned a lot on a national level. So
great, thank you for that. Yeah, there's a lot going on in there, and really it's all for our safety and for helping the patient out, definitely. All right, Melanie.
Okay, I also was just amazed as I was doing the research for this project, just how many agencies fall under the umbrella of Health and Human Services. And for me, I'm a visual person, so for me, I thought it was really cool to see faces and names associated with all of these job titles. And again, it was just amazing to see how many people are actually involved in HHS.
Awesome. Yeah, there are definitely there's a lot of leadership involved in that because it is such a huge organization. So, all right, Shayna.
What surprised me was the huge extent of the reach that each of these single departments has. And the majority of departments that come to mind when I think about the US government, they all seem to fall within Department of Health and Human Services. And then within those, different branches, I mean, they're not easy, simple things. They're huge, complex departments or sub-departments. So there's quite a bunch of wheels turning to make it all work.
Definitely. A lot of different moving parts that go into this to make a successful organization. So fantastic. Well, I'm going to go ahead and stop recording, but stay on the line for just a sec.